Dr. Stephen Levin. I'm Medical Director of the Mount Sinai Irving Selikoff Center for Occupational and Environmental Medicine. There are several approaches to the treatment of mesothelioma. There's standard chemotherapy, which has not proven to be very effective against this particular type of tumor, but there are some individuals who obtain a response with some lengthening of life and some shrinking of the tumor with these standard chemotherapy approaches. The difficulty with these treatments is that they often produce side effects, including fatigue, nausea, hair loss, and because they're not so effective, many have chosen not to use this approach. The second main approach to the treatment of mesothelioma is surgery. There have been surgical approaches that have involved removing not only the lung, but the lining of the lung, the lining of the rib cage, the diaphragm. This is extensive surgery, but in the hands of an experienced surgeon, such as can be found at Harvard's surgical program and at the Sloan Kettering Memorial Cancer Center, there have been reports of individuals who have lived over 5 years after surgery. This is a significant finding, and although most people have not gone through the surgical procedure with resulting cure, certainly there have been some cures of the disease. More recently, there's been a new chemotherapy approach, and that is known as Alimta. It's a combination chemotherapy approach, and most importantly, individuals who have been treated with this combination of drugs have experienced a real decrease in their symptoms, whether the symptoms are fatigue, shortness of breath, chest pain, and that's very important to the quality of life that people have remaining to them once people are diagnosed with mesothelioma. There also is evidence that survival for at least a few months, longer than would occur without treatment, has been observed in people who are on this course of therapy. And when the average length of life after diagnosis is only 13 months, extension of life by even 3 months, especially if those 3 months are relatively symptom-free or with reduced symptoms, that's a significant development.